According to the American Heart Association, any marijuana use was linked to a higher risk for heart attacks and strokes, but people who used it most frequently had the highest odds. Adults who used marijuana daily had 25% higher odds of having a heart attack and 42% higher odds of stroke than people who didn't use it at all. Smoking was the most common method of cannabis use, followed by eating or vaping it among men under 55 and women under 65. Using marijuana resulted in a 36% higher combined odds for coronary heart disease, heart attack, or stroke, regardless of whether they also used tobacco products. The odds were higher even when researchers looked only at those who had never used tobacco products or e-cigarettes. On the other hand, some studies have suggested that marijuana may have potential benefits for cardiovascular health. A study published in the European Journal of Preventive Cardiology in 2016 found that marijuana users had lower rates of obesity, diabetes, and high blood pressure compared to non-users. The study also found that marijuana users had higher levels of good HDL cholesterol, which is associated with a lower risk of heart disease. It is crucial for individuals to consider their own personal risk factors and to speak with a healthcare provider before using marijuana, especially if they have underlying cardiovascular conditions. I doubt if anyone will stop using pot because of these studies. But for your health's sake, restraint might be in order, especially as one gets older. It is also important to note that the potency of marijuana today is much higher than it was in the past, due to advances in cultivation techniques. This means that users may be consuming higher levels of THC, the psychoactive compound in marijuana, which can have more pronounced effects on the cardiovascular system.